the gut microbiome. Everybody's talking about it. When the Human Genome Project started in 1990, 1989, but started in 1990, they were sent out to see how our genetics are, how are they causing disease processes, and what they're finding is, what they did find, is that a good majority is due to our gut microbiome. So there's two terms that are used interchangeably. There's microbiome and microbiota. So the simplest way to kind of break this down is that the microbiome is the actual genetic makeup. It is the different categories, it's where they live. Now the microbiota are the actual microbes. Anywhere about 100 trillion microbes that are inside you. Bacteria, fungi, viruses, these are all things that are meant to protect you. Now, yes, they can cause other problems, but for the majority of the part, these microbes are meant to help us, and we need to allow them to thrive. They're important for your immunity, nutrition, mental health. They have a lot of work to do. So, what exactly affects the gut? So negatively, and again, this is a list that I made, but there could be others on there. Highly refined processed foods, morbid obesity, which is defined as a BMI over 40. That there are many clinical trials that have been completed and are continuing to be completed that is showing morbid obesity and gut dysbiosis definitely have, or leaky gut syndrome, they definitely have a correlation with one another. Stress, mental status, lack of sleep, which we'll talk about that. Certain medications, so PPIs are proton pump inhibitors. So Nexium, Prilosec, anybody taking those? Okay. So those medications, which are highly prescribed by GI doctors, primary care doctors, those medications are being shown that if you're not necessarily needing to be on them, then we have to try to take you off, because it's going to actually prevent you from healing your gut microbiome. Also, antibiotics. Definitely an overuse of antibiotics. I am not a big proponent on them unless we die or meet. I always tell my patients, if I'm prescribing it to you, it's because you have to take it. But you know, 90% of sinus infections, laryngitis, pharyngitis, any of them, 90% of that is viral. And it can take anywhere from 14 to 21 days to heal yourself, which seems like a very long time. But antibiotics, they're not going to help that. Lack of exercise, chronic illnesses negatively affect. And then also C-section delivery. If you were born via C-section, it is shown that if you didn't pass through the mother's vagina, that you're not collecting that good bacteria into your gut. Our gut microbiome isn't fully formed until about the age of 3, so it's influenced by a lot of different factors. And that's one of them, not only diet and everything like that, but the way that delivery. So positively, whole food, plant-based diet, these are positive effects. Exercise, maintaining a normal body weight, a normal BMI, certain supplements, vaginal delivery, like I said, breastfed versus bottle-fed. There's also question with that as far as the gut microbiome being formed in infancy. Normal sleep pattern, stress management, and mental health management. See, there's a lot of things. So what diseases are associated with the gut? These are just a few, okay? Definitely autoimmune diseases, certain types of cancers, Parkinson's disease. So personally, my mother, she was diagnosed with Parkinson's disease right after I was married, about 12 and a half years ago. And that really started setting me off into, okay, but why? And they're finding a lot of data correlating that a leaky gut or imbalanced gut has possibly some responsibility for Parkinson's disease. Also, multiple sclerosis is a heavily studied one. Certain types of cancers, such as colon and breast cancer, autism. There's actually a friend of mine's cousin who is severely autistic, is actually going through fecal transplantation down at University of Miami. And they're doing it specifically for the autism. So they're trying to transfer a good gut microbiome into one that is disarrayed to see if the symptoms are going to improve. And then obviously celiac disease. And then acute illnesses, meaning things that happen and then you'll get better and get over them, but there could be lasting effects as far as your gut microbiome goes. So what exactly is an autoimmune disease? So American Academy of Allergy, Asthma, and Immunology, it's an illness that causes the immune system to produce antibodies and attack normal body tissue. It's essentially your body attacking itself. TMAs, states the inflammatory myopathies are rare, estimated from 50 to 75,000. So that's why this talk is more generalized autoimmune disease versus specifically on myositis, because there's not enough data out there. But you can kind of collect all the data as far as the autoimmune diseases go, and they kind of mesh in the same way. And then also other autoimmune diseases I listed on there. There's many more. So a common element in autoimmune diseases is the presence of several pre-existing conditions. So there's a genetic susceptibility to the host, and it usually will affect in the GI tract. The host will be exposed to the antigen, and the antigen is also must be present to the GI tract. It travels from the lining into the gut, and then that's when it's released as far as the reaction goes. And I'll explain that a little bit more here. So, leaky gut syndrome. This is actually, I took this from an article, Dr. Amy Myers. It's actually really nice as far as the different signs of leaky gut syndrome and different causes, like I mentioned before. So this is a nice graph right here that shows those tight junctions being damaged and the chemicals and toxins entering the bloodstream, causing an immune reaction. You can cause food reaction, but essentially it can cause an underlying autoimmune disease to be turned on. So this is Dr. Alessio Pisano. I talked about him in the nutrition talk. He is basically responsible for gluten-free items on menus because he was the one that discovered the inflammatory protein zonulin while he was trying to find an immunization for cholera. So what he found was that when gluten was present and causing these zonulin proteins to go up, that it was causing leaky gut syndrome. It was causing a lot of inflammation, it was causing these toxins to get into the bloodstream, but then when you take gluten out, these levels came back down to normal, the mucosa healed itself, and essentially the patients were able to go back to baseline. And this is a famous quote that he says, "The gut is not like Las Vegas, what happens in the gut does not stay in the gut," which is very true. So his theory added a third route for an autoimmune disease to kind of flare up. Like I said, the genetic makeup, definitely. Environmental triggers. So that can be not only what you're exposed to where you live, but also the foods that you are taking in, your occupation, what stressors are you dealing with there, what environmental stressors that you're dealing there. But then also Dr. Pisano He found that when we have a loss of that, when we have a loss of those tight junctions, that's when an autoimmunity can develop. And like I said, it was specifically driven towards celiac disease, but they also did mention as far as type 1, diabetes, RA, rheumatoid arthritis, and multiple sclerosis in there. So this is just a graphic as far as with the autoimmune disease, the genetics. There's when you're taking these cells that you, and it's very complex as far as with the way that the cells go, and they actually will activate negatively. And then you're adding the gut microbiome being off. It's essentially a perfect storm to cause an autoimmune flare-up, either initially or subsequently. So what can you do as far as repairing your gut goes? There's different, it really is lifestyle modifications. Now, there are tests that go out there, They're available mostly through functional and integrated medicine. Unfortunately, a lot of times it is out-of-pocket pay. Getting it covered by insurance is very difficult. There are companies that you can submit to insurance, but in my experience, they don't really get very good coverage on that. But you can test and see if you have elevated levels of certain gases that could be produced by bad bacteria, and then see, okay, what is the next step? Do we give medication for it? A lot of times, a good majority is dietary changes. Also exercise, like I said, managing obesity, supplementation, stress, sleep, environmental exposures, and antibiotic use. So these are like main game changers right here, but there are also other elements that can come into play. So dietary changes, food significantly changes the composition of the gut microbiota and the genetic makeup. So removing certain removing certain food and food groups that are going to cause the gut to flare up is one of the most important things. I always tell my patients the big three are, it is gluten, dairy, and processed sugar. I don't necessarily have my patients remove it all at one time. If they did, they probably would hate me. But I tell them, okay, let's try to take one away a little bit at a time, and then if we could go on to the other. Usually the easiest one is dairy for my patients, because there's so many different alternatives out there. Gluten is a very difficult one, and then also the processed sugar. Soda is a big, and regardless if it's regular soda or artificial sweetener, like the diet ones, it will cause a systemic effect as far as inflammation. Alcohol, and I have the gut microbiome, I have the nutrition talk tomorrow morning at 7 a.m., so I can go a little bit more in depth on that. But as far as alcohol goes, there is clinical evidence showing that 1 to 3 glasses a week of red wine can have a good effect on your gut microbiome, and it's shown that it will produce more good bacteria. So as far as alcohol use, I tell my patients red wine over white, and white is a lot higher in sugar too as well, so you're taking that factor away. And I also tell my patients, if you're going to drink liquor, make sure that it's something clear versus something that is darker. That's kind of the rule of thumb, and that's purely the carbohydrate and sugar content. And then also, last one is animal proteins. I tell my patients use those very sparingly. If you are not affected by it, then that's great, but a lot of times autoimmune diseases will flare up, specifically red meat from beef and pork can cause a lot of gastrointestinal dysfunction, and thus not allowing the gut to heal itself. Definitely increase your water intake. I tell my patients that you take half your body weight, cut that in half, and that should be the amount of ounces up to 100 to 120 ounces of water a day. Obviously, if you work outside, you sweat more, you exercise every day, you sweat, you can up that. You know, you don't want to drink too much water because of the depletion of electrolytes, but you do want to make sure that you are adequately hydrated. Fiber, I tell my patients really try to up the amount of good fiber in your diet, and you can get that a lot through like avocados, quinoa, brown rice. Those tend to have that good fiber, which causes the gut microbiome to produce an amino acid that will actually cause the good microbiota or the good bacteria to thrive and kind of overtake and starve the bad bacteria. Increase certain fruits. You know, I try to limit the ones that are higher in the sugar content. Bananas have a good amount of fiber, but they are pretty high in sugar. That's one of those things where you kind of have to figure the fruits out for yourself as far as how you react to them positively or negatively. Legumes are a good source of protein. Again, that's a food group that can have an inflammatory response with autoimmune diseases, but there are patients that are able to tolerate it. So it's trying and seeing what is going to work for you. Plant-based, like I said, make plant-based choices. Try to steer away from the animal proteins. And then healthy fats. So everyone knows avocados. Avocados, like I said, are very high in good fiber too as well. Coconut oil is okay to use, and I say okay because you want to use that very sparingly in comparison to avocado oil. I usually tell my patients coconut oil is actually better externally versus internally. I like it for other things. And like I said, I have a nutrition talk tomorrow at 7 a.m. If you guys can make it this afternoon, I will be repeating it, and they will be recording that one too as well. So also exercise and obesity management. So clinical studies are showing there is a major difference between the gut microbiome of an obese patient versus what they call a lean patient. Now these are just in rat studies right now, but it is what they're doing is that they have these what they call clean rats. Their gut microbiome is not affected. They are taking the gut microbiome and transferring it to these clean rats from the obese rats, and then these clean rats that are normal weight are becoming obese. So there is a direct correlation. It's just human studies haven't been approved as far as I know as of yet. I usually do recommend my patients cardiovascular resistance training, 30 to 45 minutes a day. It does vary patient to patient, but I do like my patients being active somewhat every single day because it becomes a habit, and then you are going to do it every day. And you know, resistance training, that means, you know, the bands, light weights, something where you're going to be putting pressure on your bones and your muscles. And it increases more diversity. Like I said, it does increase more diversity of the gut microbiota, meaning that you're going to have more good strands, different good strands that are responsible for different things, and it's going to lower the bad strands, the bad bacteria. And that has been proven. This is taken from a journal, I think it was done a couple of years ago, but it's taken from a journal of sports and health science. It did show that there was a good transition in the gut microbiome. And when that happens, obviously you're going to absorb vitamins better. It's going to cause the gut-brain axis to actually work, decrease overall inflammation. The gut microbiota reduces oxidative stress and inflammatory response, while it's going to improve your metabolism and also allow you to have more energy. And then this is just a diagram out of it. Specifically, I am looking at this one right here. the exercise, it was shown in the study, it actually improved the intestinal permeability and it allowed those junctions to tighten up to protect yourself systemically overall. So, supplementation. Dr. Michael Ruscio, this is a great book, Healthy Gut, Healthy You. It's very informative, it's an easier read. He explains, you know, the gut microbiome. But what he talks about is, okay, what is the plan to heal your gut? He does discuss different medications and so forth. If you're going to purchase that book and read it, definitely bring it to your doctor or nurse practitioner, healthcare provider, and let them go over it with you as far as what a plan could be. You know, remember, supplements are medications. They can help you, but they can also hurt you. I do say that probiotics are tricky. You want to make sure that you are choosing a brand that has higher, what they call CFUs. It just means that a higher colony content, and then you also want it to have more strains, more diversity in there. There's many different brands that are out there. What I just tell my patients is do your research, and you just have to try to figure out what is best for you, because you know, one probiotic might work well for someone, but then the other person it can cause, you know, bloating, diarrhea, abdominal cramping, other things like that. Prebiotics, that is more through nutrition. Certain foods will actually help feed the good bacteria. If you Google prebiotic foods, that's the only time I really talk about Google or anything like that, is if there's massive amount of list of things and you know, kind of have my patients break it down themselves. But the prebiotic foods, I consider that a supplementation because it is going to help make that good bacteria grow more. We talked about nutrition, the nutrition one, collagen peptides and bone broth. So collagen peptides actually, they are a fine powder and they're grind down, made from cartilage tendons from different animals, mainly the one I use comes from cattle. But what that does, because of all the nutrition that it has in there, it will actually, specifically for the gut, has been proven to help heal the gut microbiome. So it helps heal leaky gut syndrome, decreases inflammation, allows your gut to actually heal, to cause those junctions to grow back, get back together, and hopefully prevent any further systemic effect. And then bone broth is around the same. You can sometimes, I have patients sometimes that will actually mix collagen peptides with the bone broth. You can either buy it from the store. I usually make sure that it's an organic source, low sodium, or you can make your own. There's different recipes. I know Dr. Amy Myers on her website, she has a really good bone broth recipe there. And then supplements, vitamins. Again, I talked about a lot of supplements as far as in the nutrition talk, but specifically vitamin D, B12, folic acid, magnesium, curcumin. There's different supplements that that are used as far as healing, actually healing the gut. So stress management. You know, I mean, it seems pretty simple. Okay, get my stress under control and it should be fine. But easier said than done, considering the world we're living in these days. Now, there are ways to help bring the stress down and suppress your, what they call your oxidative stress, which will cause systemic inflammation. It can cause inflammation in the gut and contribute to leaky gut syndrome. Exercise is a great stress management strategy. Patients use imagery with deep breathing. You can do deep breathing with yoga as well. Positive affirmations, where, you know, that's not even, you know, talking to yourself, but there's different books that are out there that help you with that. Different quotes on social media platforms. Meditation. One app I do recommend to my patients is the Calm app. I feel like it's a pretty easy way to start incorporating meditation into your everyday life. I mean, they even have like 5-minute ones where you're focusing on your breathing, and that can help with stress management. And then also I have patients who journal. Journaling is a very, very therapeutic outlet. And then also coloring. I have patients that color that it helps with calming them down. So this is just a grid from the National Sleep Foundation as far as what the recommendation for amount of hours that we should be getting for sleep. I can tell you that I'm probably guilty of not getting anywhere close to that sometimes. But it is, recommended anywhere from 7 to 9 hours as far as the adult or older adult. It says 7 and 8, but kind of blend those two together. Obviously, when we're younger, we need more hours of sleep, but as we get older, it does dwindle a bit, but we don't want to go too far from the 7 to 9 range. So different sleep hygiene things that you can do. Set a bedtime routine. Even if, let's say you go to bed at 11 o'clock, I'll tell my patients, okay, set the alarm for 11, and then set it back to 10:30. So it's not something that will happen overnight, but it's something that you can, make little changes and incorporate that in. Exercise in the morning or afternoon. This does vary with my patients. I need to exercise in the morning. If I exercise in the afternoon, I will be up till 1 o'clock in the morning because it just gives me more energy. But I have patients who exercise in the afternoon because it actually will cause them to sleep deeper. They get more in that REM cycle and they get more hours in that REM cycle. Adjust the temperature. Clinical studies do show that colder temperatures do allow for more sound sleep. Avoid caffeine or alcohol at least 2 hours before your bedtime. Alcohol is not going to help you sleep. It actually can depress you a little bit and cause you to feel tired, but then a few hours later, as it's being metabolized in the liver, it will actually kickstart you and wake you up. So just be careful about that. Turn off all electronics. This is kind of an obvious, but it's very hard. What I do is I actually put my phone in the bathroom away from my bed, so then that way I know that I'm not going to go near it. And then when the alarm goes off, it makes me get up physically and get it so I can start my day instead of hitting the snooze button, which I can do that too. Also, blue light blocking glasses. This is kind of one of those things where there's not a lot of data behind it, but it is showing that blue light from our phones, computers, anything like that, actually can deplete melatonin in our brain, and that melatonin is an important supplement that is going to help you go to bed. Some people, will take it as a supplement to go to bed, but the blue light has been shown to deplete that, and then once it's depleted, it does not repair itself. So that's a little shocking right there. And then also journaling and imagery, using those same methods before bed. So environmental exposures. This is very, very common in patients with leaky gut syndrome, autoimmune diseases. Mercury. I'm sure if you've been to a functional medicine or integrated medicine doctor, you've talked about mercury, you've been tested for mercury. A lot of us have mercury toxicity from fillings, from things that we're eating. I've had some patients that have had all their fillings removed and replaced, and just to get the mercury out of their bodies. They'll go on what's called elemental diets to deplete the mercury, which essentially is a liquid diet. Also, cigarette smoking. Cigarette smoking, there's nothing good about cigarette smoking. I tell my patients, it's my job to harp on you we gotta quit, we gotta find different methods to stop, because it's not only going to be contributing to overall inflammation, but specifically for the gut, it's going to deplete all your good bacteria, and you're not going to be able to replace it. You're also going to deplete little guys in your small intestine called intrinsic factors. That once they're gone, they don't repair themselves, and those are responsible for absorbing B12, folic acid, very important vitamins that we need. Occupational hazards. You know, if you're a firefighter like my husband, if you know, work in a factory of some sort, if you are inhaling any kind of toxins, that can contribute as far as the gut microbiome and inflammation go. Also, where you live, you know, if you live in a nice farm out where there's no people or anything like that, it has been shown that patients who do live on a farm and they don't have a lot of environmental toxins from an urban city, they actually have a better gut microbiome than the ones that are living in an urban city. And that simply goes back to the toxins around the realm of occupational hazards. And then also UV exposure that has been shown as far as contributing to depleting the good bacteria in your gut. And then antibiotic use. Unfortunately, like I said, antibiotics are overused, or you are prescribed them and you take them for 3 days and you're supposed to take them for 7 because you're feeling better, and you want to save them for the next time, and then you treat yourself without going to see your doctor. So unfortunately, this not only leads to us depleting the gut microbiome and causing us to allow these bad bacteria to thrive and cause us to not feel good, it's causing superbugs that need antibiotics, allowing them to overtake the ones that we have where we're limited in, as far as healthcare providers. Like I said, majority of times, upper respiratory, sinusitis, sinus infection, 80 to 85% are viral. It's probably somewhere around 90. And, you know, obviously antibiotics do need to be used at certain times, and when we need them, we want to make sure that they actually work. So, you know, cellulitis, which is an infection in the skin, if you have an abscess that has developed and could possibly get into your bloodstream, that could be life-threatening. Urinary tract infections that can get in your bloodstream. So, you know, there's different things that we need antibiotics for, but if we're overusing them for viral infections, they're not going to work when we need them to work. So, what if you need an antibiotic? Like I said, take it completely. There's controversy as far as taking probiotics with an antibiotic or not. There's really not a lot of strong data out there that shows that it's good, bad, and different. Sometimes I have patients, they are insisting on taking it because of diarrhea. I'm fine with that. Like I said, rest, hydration, making sure you're staying properly hydrated, and then also making sure that your diet is healthy as possible while you're on the antibiotics, because especially with prebiotic foods, because you want to feed that good bacteria in there and try to eliminate as much inflammation and disarray that whatever infection you're treating can cause. So, like I said, it's a very complex subject. I tried my best as far as getting it to a level to understand it. But I mean, the overall is that there's definitely a relationship between autoimmune diseases and the gut, and then also autoimmune diseases as far as flaring up in symptoms and leaky gut syndrome. Certain factors can either affect it positively or negatively. Leaky gut, like I said, there's going to be people that say leaky gut syndrome is not real. It is real. It is real. There's clinical studies that are out there. There's so much data out there. You can't deny it. Also, the classic paradigm of autoimmune disease, not only your genetic makeup, environmental triggers, but also that part as far as the intestinal permeability, the function being compromised and causing leaky gut syndrome. And there's also different ways that you can start healing your gut today. These are books that I do recommend. I do recommend these in my nutrition as well, but pretty much all of them are very good. Dr. Amy Myers, her father actually was diagnosed with polymyositis, and she was diagnosed with Hashimoto's thyroiditis, so the autoimmune thyroid disease. So there's definitely a genetic disposition in her family, but it's very interesting that now she's taking this route as far as specifically treating autoimmune conditions. The cookbook is great. I do recommend that. She has some complex recipes in there, but then she has some pretty easy ones. Her bone broth recipe is in there. It's very, very good. Dr. Mayer, the mind-gut connection, that's a really good read as far as understanding the gut-brain axis. So if you're on any antidepressants, anti-anxiety medications, if you've been diagnosed with depression, anxiety, anything, this would be a great book for you to read because you can kind of understand how your gut microbiome intertwines with that and can allow your medications to work better or even decrease the dosage or anything. I have had that happen in my experience, and my patients have been very, very happy with that. The Healthy Gut, Healthy You, definitely recommend. Dr. Shaw, she recommends the Happy Gut. I've read a little bit of it. It's pretty complex. It was a difficult read. But the Healthy Gut, Healthy You has a lot of information. He just has a really good way of kind of explaining it to a level that we can all understand it. And then these are social media and podcasts that I do recommend. So social media, people that, Dr. Terry Walls, if anybody's done any kind of gut health research, knows the story with Dr. Walls, and she has the Walls Protocol. Gut Health MD, he's great. He's a gastroenterologist that he's in North Carolina, but his clinic focuses just on gut health. He's great. And then Dr. Ruscio's podcast is fantastic. If you listen to podcasts, I highly recommend that one. And then Dr. Mark Hyman, who's the Director of Functional Medicine at Cleveland Clinic, he has a great podcast. And then Dr. Danielle Bellardo, she actually runs a plant-based cardiovascular clinic where she's essentially reversing cardiovascular disease through diet. So having a healthy gut means more than just not being annoyed by a little bloating or heartburn. It's the central of your entire health. It is connected to everything that happens in your body. And that's from Dr. Mark Hyman. And then these are the different ways that you can reach me if you have any additional questions, if you find anything online, if you want to ask about a supplement, anything like that. Dr. Shaw and I are very active, like I said, on social media, and you can always email us or message us. We'd be happy to answer any questions for you. And that's it.
Thank you.
All right. Does anybody have any questions or comments?
I have a question. How do you get your, is there a way to get it tested, to see what's in your...
So, like I said, there are what they call breath tests, where, you drink an elixir and you breathe into these tubes in 15-20 minute increments for a certain period of time. And what it is testing is to see the amount of certain gases. If there's any elevation, that would indicate that there's an overgrowth of bad bacteria. Now, as far as treatment goes for that, it's purely up to your provider. There's an antibiotic that they use called Xifaxan. Super uber expensive if you get it covered. And it only works, to be honest, it only works like 20% of the time for my patients. But and then it's also the follow-up work to keep it at bay. That they can. You can go as extensive as doing an EGD, which is an upper scope, and if you have the right gastroenterologist, they're able to test certain parts of the small intestine. But other than that, there's really a test to see what kind of microbes that you have in there, the amount. There are stool tests that you can do too as well. That can show, that one can show the amount that's in the large colon. It's not going to show you the amount that's in the small intestine. But that test has been pretty helpful for a few of my patients, and then the old practice that Dr. Shaw and I were at, we started incorporating that. But again, conventional medicine and getting that covered was like pulling teeth.
I tried to get a stool test, it was 5,000 milliliters.
Yeah, that's about it. Yeah, it's crazy. It's.
Can you tell, you mentioned cigarette smoking depletes some kind of intrinsic factor in the gut.
Yeah.
So I quit smoking 40 years ago, so that will never recover?
Unfortunately, no. Once it's gone, it's gone. Until there's further data to kind of counteract that, I don't know, but once it's gone, it's gone. Now that's why, as we do get older in life, our B12 and folic acid deplete, because with age, they just go away as well. But with cigarette smoking, unfortunately, we kind of increase that process. You know, same with patients, you know, if you are, you know, in your late 90s or 100, you will have chronic disease in your lungs just from wear and tear, but the cigarette smoking speeds that up.
Thank you.
Mm-hmm.
Hi. Are there epithelial cells in the stomach?
What was that?
Are there epithelial type cells in the stomach?
Yeah, I mean, I would think there would be. Yeah.
I've heard that.
Yeah, because they, I mean, that is more for like a pathologist, but I've seen that on biopsies, GI biopsies.
Yeah, I was talking to you a little bit earlier about the plant paradox.
Yeah.
Can you comment on that book?
Like I said, you know, Dr. Gundry definitely, I mean, he's done great work with that. It's, you know, as far as the way the book goes, it can get a little complex. I'm more of the route of, there is a difference between functional medicine and lifestyle medicine. I'm more around lifestyle medicine because I feel that it's more doable for my patients. I feel that incorporating that completely can be a little overwhelming. Yeah, it can be a little overwhelming, and it kind of can make you a little crazy, like looking at the labels and like, oh, I can't eat this, I can't do that. But I mean, he's been able to reverse autoimmune. Again, this is what he's claiming, but autoimmune diseases, cardiac disease, reversing type 2 diabetes, things like that.
Critical science, autoimmune disease.
I mean, there's no clinical studies to show that it will prove that. I can't say. Well, I mean, with autoimmune disease in general, I mean, there's certain types of autoimmune diseases that you can put in remission. It also depends on your level as far as the autoimmune disease. There's a lot of different factors. I mean, that's a multifactorial question right there. But I mean, it does have, he does have very good testimonials and outcomes in that book. He does.
So you recommended limiting or eliminating animal proteins, and maybe in contrast, I think Dr. Amy Myers recommends grass-fed and no antibiotic and hormone free animal protein.
Yes, absolutely, absolutely. I mean, you know, like I said, you know, the animal proteins, that's going to be, and I'm specifically talking about symptoms that my patients can have from leaky gut syndrome. Some patients totally unaffected by it. They're unaffected by it. They're fine. But I do tell them that, you know, if you are going to eat red meats, you know, make sure that I do recommend grass-fed, organic when it's possible. You know, sometimes if it's going on sale, you know, freeze it, you know, kind of think ahead in that sense. But the fact of the matter is that taking high amounts of red meat and pork As a family nurse practitioner, you look at the patient as a whole, not just one disease process. So I'm kind of thinking, okay, well, the autoimmune disease, but then what about the cardiovascular disease that can be underlying or kind of enhanced because of the autoimmune disease, so it's different, there's many different factors. What I would say to that is that it's bio-individuality, it's how you react to it, and how your lab reacts to it too as well. But I do agree, when you can, grass-fed organic is the best.
When you were talking about supplements, with supplements not being regulated, how do you know if you're getting a good supplement or if they're a bad supplement?
So that is where and that's a great question because you don't know. That's where you and your healthcare provider do the research together. I have my patients bring the bottles to me, and if I'm not familiar with the brand, then I'm doing research on it. If I am familiar with it and I want them on something different, I suggest it. In this world, when something is better than something else, it's usually more expensive. So I do have to take that into consideration for my patients because a lot of them are on fixed incomes. So we have to work with that too as well. But I would say, talking with your doctor or nurse practitioner and going through it together.
I wonder what your opinion, you're talking about all these things you can do. I read this book in the last 5 years called Epidemic of Absence. I don't know if you've ever heard of that. And basically they go out and study and figure out that you've killed off so many of the good bacteria that's what they argue leads to a lot of these issues. If you go study Aboriginal people, they don't have any of these autoimmune problems. I just wonder what your thoughts are on that.
Well, there's a lot of studies as far as looking at different demographics. I know Dr. Fasano, he is from a part of Italy that these people live until they're like 110, and they're drinking wine every day, and they eat, carbohydrates and everything like that, but it's because they're coming from fresh sources, it's not processed, there's added preservatives and whatnot. But no, we do deplete the bad. My whole point of the PowerPoint is trying to give you guys tools to enhance the good that we do have, but then also ways that you can provide your gut more good bacteria. But for the most part, unfortunately, we do have this underlying bad growth, we just don't know it.
You mentioned there was a study on taking some of the bad microbe out of an unhealthy rat, putting it in a healthy rat, and then that rat gets obese.
Mm-hmm.
Have they done it the other way around to see if taking something from the good rat into the obese rat will make him heal faster?
Yes, they did it with that study. I don't know if it was that study or if there was an additional study. They presented it at the functional medicine conference. I'd have to go through my thing, but yes, they did do that, and the obese rat was actually able to lose weight. Now, I don't know of anything as far as the gut microbiome being transferred, like I said, in humans, but it's definitely coming down the line for sure.
You were talking about cigarette smoke and environmental or occupational inhalants and that type of thing being triggers. What would you think about not necessarily a direct exposure to cigarette smoke or an occupational, like an old fire or something, but a remaining odor and a remaining kind of...
Like a secondary exposure? Oh yeah, absolutely.
Do you think that's a possibility?
Mm-hmm, absolutely. I've had many patients that have come in with COPD, emphysema changes on CAT scans, and they would never smoke a day in their life, but their husband did. And would keep the window, they would smoke in the house, all these different things, but they developed emphysema because of that secondary exposure.
They're actually breathing the secondary smoke, but what about if somebody wasn't even breathing the secondary smoke, but went into a place where the smell was kind of still remaining? Would you think that would be...
Well, we're all exposed to that. It's just a matter of trying to divert your way, because kind of getting yourself out of that position. Though that type of exposure, unfortunately, is kind of out of our hands. The ones that are out of our hands, obviously, are with our immediate families and, you know, and everything like that. But, you know, that's why patients are developing chronic changes in their lungs and everything like that, because of the fact that they inhaling that over X amount of years, it's going to have damage. So
getting back to the intrinsic factor that she was talking about, and the folic acid absorption. So obviously a lot of people that have myositis have taken methotrexate, and that causes a decrease in folic acid. And then if you have no intrinsic factor anymore, how do you solve that problem?
well, it's providing the supplementation. So the intrinsic, okay, so these guys in your small intestine are going to absorb it primarily from food sources and everything like that. When you are taking the supplement and you're providing the extra amount, it will get your numbers up. Now, it depends on where your levels are at and everything. Usually the recommended dose when you're on methotrexate is 1 milligram. But you aren't taking that much in as far as with your diet, just regularly eating. So you're giving yourself a little bit more in there, which hopefully will keep those levels up. And then also, if you keep your B12 up, you know, B12 can be given iron shots too. Folic acid and B12 kind of follow one another. So if the B12 is up, it'll allow the folic acid to be absorbed a little bit better.
What do you think about having to have a methylated form of folic acid versus the regular form?
I mean, as far as speaking on that, I would have to do more research on that. I have to, you know, kind of do my own kind of digging around. But you know, I would go by what your numbers are showing. I'm assuming, do you have folic acid levels checked?
Yeah, what's her medicine? It's really low. But it's on methotrexate. She's taking a bolt of folic acid. It's not going up.
Is he on B12 shots too? No? That might be...
That's moderate. It's moderate.
What... Oh, we'll talk. Yeah, we'll talk. Yeah. Because moderate is going to be a different definition for someone else. I've had patients who come to me and their B12 is 250 and they're like, well, my doctor said it's normal, it's in the normal range. I'm like, no. You know, we need to get you on B12 shots now. We got to get that number up. And what number do you want to be at? I don't know. You know, I mean, whatever number I can get you at. Anywhere from 600 to 900 I'm happy with, especially if it's that low.
Just to confirm what you had said about the probiotics, I went through all the tests. I was on the Dietary, which is a wonder drug, because I had gastric erosions in my stomach and nothing was staying in me.
Oh, that's...
And the gastroenterologist that I went to recommended, I had been taking probiotics. I was taking acidophilus for years. And
So you were just taking one strand though?
Yes.
Okay.
So then this gastroenterologist recommended the probiotic that's called Bifidobacterium infantis.
Yeah.
So I just tell people if they're looking for a probiotic, look for the one that has infantis, say for babies, infantis, I-N-F-A-N-T-I-S. Because you can never remember the whatever the long word is.
Well, that's awesome that the Xifaxan worked. Unfortunately, with the Xifaxan, it also depletes the good bacteria as well. But if it works, that's awesome. That's awesome.
And so I just take the probiotic. I mean, and it has a strain of other ones in there.
Yeah.
I know a line is one of them, but it doesn't have as much as if you go to there's a Walgreens brand, or there might be a Costco or a Sam's Club brand.
Yeah, I usually recommend Garden of Life to my patients. They have a higher content, more diversity, and a lot of times you're going to find those specific strands in there because they're common. What's that?
I think it has 4 different strands. The one I get, like at Walgreens, has 4 strands in there, and it works wonderful. My gut problems have been reduced by over 50%.
And that's awesome. So if it works for you, that's great, but it might not work for her. And she might need more strands and a higher CFU than what works for you. It's a matter of just being in tune with your body and knowing. And that's why when my patients and I are going through these different transition periods, I make them journal. Even if they don't want to, I'm like, just go in the notes app and talk to me. I just want to know how you're feeling because I can pick up clues in there that they might not even think are anything. So.
Can everybody actually do their evaluations, and there's a basket over by the water there to turn them in?
Is fasting good for the health? Is fasting good for, guts? And
Yeah.
other question is, how do I know my gut is working nice?
Well, you'll know if your gut is working nice because you're not going to have any kind of potential gastrointestinal symptoms. That's what you will feel. What we'll notice, like on clinical labs, would be inflammatory markers and so forth. Vitamin levels are at a good level because you're absorbing that fine. Now, as far as fasting goes, there's a lot of clinical data that's out there, and it is exciting, but there's not anything that is steadfast. This is what you need to do. I was talking to I was talking to you guys about that, and there was a Dr. Michael Ruscio. He talked about it on one of his recent podcasts, but they did a clinical study as far as cardiovascular disease and fasting and obesity and everything. And the most success was the one that was 36 hours fasting. And I was like, ooh, man, I don't know about it. Like that's when, and some functional medicine or integrated doctors, as far as like with that extreme fasting, will actually have the patients admitted and monitored and everything like that. So it's a little much. But as far as gut health and fasting, there is some exciting things coming out about it. But we just don't, whenever there's something new and exciting out there, we want to know, okay, the next step, okay, it's repairing what's going on immediately, but what are the long-term effects? What do we have to worry about later on? So there are longevity studies going out there for that.
Last question.
Yeah, it's not a question, but I was going back to the probiotics.
Yeah.
So I was taking probiotics too, but if you had a slower moving gut, you can build up lactobacillus overgrowth, and it's not fun.
No.
And then you have to build the diet off with supplements and or herbals, whatever. But you can get in trouble with probiotics. And so you have to know if your gut is working properly. Maybe that works, but you have to.
Did they check your motility? Is that how they?
No,
or is it purely symptoms?
I have lactose intolerance, so it's just, we know that it's a gut issue.
Mm-hmm.
But, so I don't take probiotics too often. Once in a while I do, but not regularly. I do.
Yeah, so, I mean, that's a perfect example. Yeah.
Ammonia levels is bad.
Mm.
So, you do
That's
have to be
scary.
careful. Yes.
That's very scary.
Yeah.
Wow.
Yeah, so probiotics aren't always the answer. Even though, I mean, you can do foods, yogurt and stuff like kefir.
Well, and you can also do prebiotic, kefir and everything like that, kimchi, things like that will feed the good bacteria you already have.
Right, and there are prebiotics that a person that has gut issues can handle. Other prebiotics are not so helpful.
No, they give you a lot of distension. Yeah.
Yeah, so I found out banana flour is a prebiotic that's very good. Green banana flour. I just found it out. So there's different people that know things, and it's very interesting.
Mm-hmm. It is. Okay. All right. Thank you guys. Like I said, if you have any other questions or anything like that, I'm going to be here all day today and tomorrow. If you want to reach me on any of the social media platforms, Dr. Shaw, she's fully aware too. She and I would be more than happy to answer any questions, and if we don't know it, we will find out for you guys. So thank you very much.